I'm Dr. Anuradha Kapoor. I'm the Senior Director and Head of Unit at the Department of Obs and Gynae, Max Smart Super Speciality Hospital, Saket. Today we will be discussing fibroids. What are fibroids? Fibroids are the commonest benign tumors seen in women. The incidence in India has been shown to be about 37% in rural India and about 24% in urban India. Overall, they say that by the age of 50, there's an incidence of 70%. So fibroids can be of three types. They can be either inside the cavity of the uterus. They are known as submucous fibroids. Or they can be in the muscle of the uterus, which is the commonest type of fibroid. They are known as intramural fibroids. Or they can be outside the uterus on the serosa, which is known as subserosal fibroids. The subserosal fibroids usually do not cause much symptoms. So now we are coming to the fact of what are the risk factors for anybody to get fibroids. So what are the risk factors for developing a fibroid? Fibroid is seen usually in patients who have an early menarche. That means they have the periods before the age of 10 years. It is also seen in patients who are nulliparous. That means they have never born children. It is also seen in patients who are obese. Obesity is also a risk factor for developing fibroids. So also is vitamin D deficiency. It has also been seen that patients who have hypertension for long standing also have a predisposition to develop fibroids. Women who have been exposed to diethylstilbestrol when the fetus is in utero, those fetuses have also been seen to have more chances of having a fibroid. So these are the risk factors for developing fibroids. So what are the symptoms of fibroids? So the patient with fibroid can also have pressure symptoms. If the fibroid is big and is anterior, then it can press on the bladder and cause a feeling of wanting to go again and again to pass urine. Sometimes it can also land up in a urinary retention. If the fibroid is posterior, it is going to press on the rectum, so it is going to cause constipation. It can also cause a feeling of bloatedness and distension and the abdomen becoming big in size. So these are the symptoms because of the size of the fibroid. Sometimes you also have pain because of the fibroid. How do you diagnose fibroids? When the patient comes to us with either any of the symptoms of heavy bleeding or pain or pressure symptoms, then firstly we examine the patient. That means we do an internal examination. After that, we send the patient for an ultrasound. Ultrasound TVS, that is a transvaginal ultrasound, is much more accurate than a transabdominal ultrasound. After that, we have to map the fibroids if you're planning a surgery, because we want to know the location, the size, the number of fibroids before we operate. So then we send her for an MRI pelvis. After that, we can plan her management. So what are the management options for fibroids? Nowadays, we have a lot of options for fibroids. It's not that we have to rush into a surgery. We have medicines which can control the size and the symptoms of fibroids. So we have medicines like, supposing you're just having regular periods but heavy periods, then we can just give you Tranexa, which is something which will decrease this bleeding to about 50%. If this works, well and good. Otherwise, we also have what we call progesterone receptor modulators like ulipristal and mifepristone. These are oral tablets which will help in controlling the bleeding, the symptoms, and will decrease the size of the fibroids also. We also have injections known as GnRH analogs which can decrease the size of the fibroid and decrease the symptoms. But usually they can be only given for 6 months. So we use the GnRH analogs just before surgery. Supposing the patient is very anemic and she's bleeding a lot and we have to do a surgery for her, we want some time on our hands. So we give a GnRH analog for 6 months, build up her hemoglobin levels, and then plan a surgery for her. We can also have surgical managements, but before that there's a minimally invasive approach to managing fibroids. So in that we can either do a uterine artery embolization. That means we just embolize the uterine artery which is feeding the fibroids, so the fibroids will shrink in size and the symptoms will decrease. So this is a very good option that we offer to our patients, but it is done for patients who have completed their family, who are not planning future fertility. The other option that is a minimally invasive option is known as MR guided focused ultrasound energy. That means what we do is that with MR guided, we see localize where the fibroids are and a focused ultrasound energy is given to them to ablate, to do a thermal ablation of the fibroids. That means the fibroids will shrink in size by about 30 to 40%. The symptoms will also decrease And the advantage of this is that patients can plan future pregnancies also with an MR guided FUS. If all these things don't work, then we think of surgery. Surgery also, there are many options. Either you can do a myomectomy, that means just removal of the fibroid, or if the patient has completed a family and there are multiple fibroids, then we can do a hysterectomy. So hysterectomy is a last resort for us. It is not something that we diagnose fibroids and we do hysterectomies. Myomectomies can also be done by different routes. Supposing the fibroid is submucous, what I explained to you earlier, that is, it is totally into the cavity of the uterus or mainly into the cavity of the uterus, then we use the hysteroscopic approach. That means we go through the vagina with an instrument known as hysteroscope, we resect that fibroid. Supposing it is mainly intramural, then we can do a laparoscopic approach. But supposing there are very huge fibroids, more than 10 centimeters, there are multiple fibroids, more than 5, then sometimes we do an abdominal myomectomy. So that is how we decide which route to choose. If we have to do a hysterectomy, that means the fibroids are large, if she's completed a family, she does not want any conservative management, she has decided, sitting with her doctor, she has decided on a surgery, then we do a laparoscopic hysterectomy. That means through the laparoscope, through a keyhole surgery, which is completed in about an hour and a half, and the patient is admitted for 2 days. It's less painful, less hospital stay, recovery is much faster than an abdominal hysterectomy. But for some reasons, if there are a lot of adhesions, if she's had previous many surgeries, if you think laparoscopy, or if she's a heart patient and you think laparoscopy will be difficult or is contraindicated, then we resort to an abdominal hysterectomy. My message to all the viewers is that fibroids can be prevented to a certain extent if you have a healthy lifestyle. That means you add a lot of fruits and vegetables to your diet, decrease the sugary and the red meats, and there should be no vitamin deficiency, there should be no obesity. That means you should maintain your weight at the optimum level, do regular exercise, avoid alcohol, and report to your gynecologist in time. Thank you.